Hello and welcome to Fit Professionals. My name is Michael Coleman. This video is part one of a two-part series. One of the first things I learned when studying to become a corrective exercise specialist and personal trainer was the importance of having a very strong referral network. Of course, no one knows everything. That's why it's part of my duty to refer my clients to other therapies and other doctors who can help them in areas outside of my scope of practice. Like Dr. Alexander Young, a cutting-edge chiropractor who uses a technique called torque release. Check out the video for more information. Dr. Young, thank you very much for letting me come out. I wanted to learn a little bit more about this. I think it's torque release technique. Right?
Yeah, so with torque release technique, we don't do any twisting, cracking, popping. So a lot different than your traditional chiropractor. We actually use an instrument for all of our adjustments. And that instrument really focuses on adjusting the nervous system. So that instrument actually fires at the same frequency as your nervous system. It also allows us to adjust it directly and get better results faster.
Okay. What's this called?
Yeah, the instrument's called an integrator.
Integrator.
Yep. So it looks a lot like an activator. Activator is an instrument a lot of chiropractors have. A lot of people, if you've been to a chiropractor before, are familiar with it. And they look really similar, but from a scientific standpoint, they're actually completely different. Every single time that the integrator fires, it fires with the same amount of force in it. So it fires at 1/10,000 of a second, so it fires really, really fast.
Wow.
Fires at that same frequency, same amount of force in every adjustment.
So the activator is different. What is the activator?
Yes, so the activator is different because it's more like a rubber mallet is the way I describe it. It can be used as hard or as soft as the doctor wants that day. And so there's no reproducibility behind it. It's not tuned to a certain frequency. It's a lot simpler of an instrument.
Okay, well thank you.
Yeah.
Okay, Dr. Alex, again, thank you very much. I would like to talk to you about the process that someone goes through when they come in. So we talked a little bit about the torque release technique, but the onboarding process, even I think with the patients and friends that you have that come here, I think is really interesting and very unique. I've never heard of this process before. And one of the first things I personally went through was this assessment of the muscles. I don't know if I'm saying it correctly, but can you tell me what that is, how frequently you have to do it, and what the benefits are about that?
Yeah, absolutely. So on a practice member's first visit, we typically start out with an SEMG assessment or surface electromyography assessment, fancy word for a muscle assessment, along with a nerve assessment. The muscle assessment, the technology behind it's really similar to an EKG of your heart muscles. So it's looking at the electrical activity that's flowing through your muscles, but rather than looking at your heart muscles like an EKG, we're looking at those muscles that move and support your spine or your paraspinal muscles. On this assessment here, do you want me to jump in?
Yeah, you can tell them that it's me. I volunteered my body for science.
I appreciate it. Okay. So on Michael's assessments here, this left one is his very first assessment. So we can see some areas of concern. So when we look at this black line, that is the muscle activity on the right side, muscle activity on the left side. Ideally, we want it close to following that white line that we see. So it should kind of look like an onion a little bit. But when we see it jut out like this or like this, that's indicating that those muscles are working a little bit too hard. They're what we call overactive. That's really similar to if you went to a traditional chiropractor and they felt your back and said, those muscles feel tight there, something doesn't feel right there. But instead of just trying to remember from 1 month to the next and from one patient to the next, how tight a muscle actually is, we're actually able to get numerical data on it and measure your progress throughout care so we can see, are your muscles getting tighter, are your muscles getting looser, are they working the way that they should. When we look throughout the mid-spine here, we see some overactivity on the right, but we see some underactivity on the left. Once we reach that yellow line, those muscles are considered underactive. And that's not because that Michael needs to go and work out or lift weights. It's because something within that nervous system, within that spine, is physically keeping those muscles from working the way that they should. Sometimes it's degeneration, sometimes it's abnormal curvatures, sometimes it's our posture. They all play a role into how our nervous system and our muscles function every day. When we look at the right muscle assessment here, this was a progress assessment down the road. We can see that we see more muscle activity throughout the area where we were underactive. You can see the overactivity has settled down quite a bit into the more normal region. So definitely.
If I can interrupt, how frequently would you do something like this assessment for most patients?
Great question. So for most patients, we typically will do the first assessment about a month into care, and then every 3 to 6 months after that is when we continue to do those assessments.
I really appreciate it. Thank you very much. Okay, part 2, and that is me again. I had less hair at that moment. But anyway, so part 2, I think, is the thermal assessment or nerve assessment. Can you explain a little bit more about that and kind of get into detail as to what those pictures are telling us?
Yeah, absolutely. So this is a nerve assessment, or the fancy term for it is a thermal assessment. So when we look at this assessment, what we want to see is short white bars, kind of like what we're seeing up at C1, T5 on this assessment. This was Michael's initial assessment here. So what we want to see is these big chunks, these long lines start to break apart, start to become shorter. We don't want to see the green lines or the blue lines. Green means there's mild nerve interference. Blue means there's moderate nerve interference. And red would mean that there's severe nerve interference. So when we look at this assessment, there's definitely some room for improvement. As we move over to the progress assessment, you can see that we really started to break those lines apart from side to side. We see some on the right, some on the left. You see the lines got a lot shorter. That means that his nervous system is starting to adapt better. The nervous system is starting to adapt and function the way that it's supposed to.
So you mentioned the nervous system. Can we see a little bit of what you're talking about here?
Yeah, absolutely. So we like to call this guy Bob. So this is obviously a model of someone's spine. So your brain would sit up here, and your brain actually sends signals down through this hole in the bottom of your head. It's called foramen magnum, which is literally Latin for big hole. Someone was really creative. As that brainstem turns into the spinal cord travels down throughout here, and then we have these little nerves branching off from each level of the spine. Those nerves are what carry messages from your brain to every single cell, tissue, organ, muscle in your body. So if these nerves aren't functioning properly, that means we can see dysfunctions throughout the entire body.
Would for example, the T10 and T11, would that tell you that there's some kind of subluxation on one side, or would that just tell you about, what does that tell you just from that scan?
Yeah, so it tells us there's a subluxation somewhere in that area. Subluxation is a word that we use to describe when the nervous system's not functioning properly. So the nerves in this area of someone's spine control
my spine
of your spine. Those are going to control the muscles in your back in that area. They're going to control the digestive organs. They're going to play a role in your kidneys, your liver, your adrenal glands, all those important organs.
Okay, well, I'm glad that I had some work done. Thank you very much. I appreciate it. Why do you do x-rays?
Yeah, there's a couple reasons. One, it helps us to see and know what's going on. So we always say to see is to know, not to see is to guess. And we never want to guess with anyone's health is the simple way to put it. But if we don't have x-rays, we don't know how much degeneration is here, what those disc spaces look like, how much arthritis do we have. And we don't know what it's going to take to get you back on track. And we aren't able to set realistic expectations as to how long it's going to take. Without x-rays, it might take a month, it might take 2 years, might be somewhere in between. We can't really be sure, but when we have x-rays, we're able to get a better idea of what is it going to take to get you back on track, help you reach your goals.
Dr. Alex, I have had x-rays done before. I've also had MRIs done specifically on this particular part of my back, because this is one of the reasons why I came here. Actually, I didn't really want to come to you, but the results over here on the left here have I'm sure they show that I made a really good choice. And within the last, I think these were about 10 months after I met you. So since we're talking about them, I'd like to go into these particular ones first.
Yeah, so these are the x-rays we took the first time we met you in our office, and then these are the progress x-rays over here. So if we focus on these two spots down in the low back, we can see that there is a loss of disc space. So this area here is the bone, the big white part, and in between we have a disc. Think of it kind of like a cushion or the jelly in a donut is the way I like to describe it. If we put all the pressure on this back portion, that jelly is kind of getting squeezed out. It makes you more likely to be able to have a disc herniation, disc bulge, and have more aches and pains. So you can see here we have more of a proper structure. When we have that proper structure, we have more of a space between those bones. There's a lot less pressure on that disc, so makes someone less likely to have an injury.
And then for me, the bottom disc here, the L5, that area was really, I did have some nerve dysfunction in that area, which went down my leg, which was not fun.
Yeah, so same thing here. We have a lot of a loss of disc space in that L5S1 disc, and that the nerves down here in your low back at L4, L5, S1, they are going to go down into your hips, your legs, your ankles, feet, toes. So when we get a lot of pressure on them, or those nerves get pinched, it can start to cause symptoms like numbness, tingling, in severe cases even loss of function, not being able to use those muscles the way that someone wants to.
So this is something that I was really proud of, and I've shown this to several people now because anybody can see the massive difference in such a short period of time. So I really appreciate what you did for me. So learn how to train pain-free. Get the most effective pro tips delivered to your inbox each week by subscribing today to our free newsletter at fitprofessionals.beehive, BEEHIIV.com.